Tonight on KQED Newsroom, President Trump signs into law another round of federal coronavirus relief funding. We'll talk with a California Congress member about the winners and losers in the latest deal. Plus, in the first study of its kind in the nation, UCSF researchers are testing everyone they can in 2 local communities to uncover how the virus spreads. And as protesters across the nation call on governors to open shuttered businesses, we zero in on one California county that's pushing to reopen right now. And we connect with a best-selling local artist who's inspiring kids around the world to pick up their sketch pads and draw with her. I'm Priya David Clemens. Hello and welcome to KQED Newsroom. It's week 6 of sheltering in place in Northern California. We're continuing our ongoing coronavirus coverage. Today, President Trump signed into law a new $484 billion stimulus package passed by Congress this week. The bulk of the money, $310 billion, will replenish the Paycheck Protection Program for small business owners. This second round of relief also includes funding for hospitals, testing, and disaster-related loans. Joining me now by Skype from his home in Elk Grove, California, is physician and Congressmember Ami Bera. Congressmember, thank you so much for joining us this evening.
Thank you for having me on.
Let's start with the Paycheck Protection Program. What is different in the legislation this time to make sure that the smaller businesses, the mom and pop shops, will get some of this funding?
You know, what we saw in the first iteration, the first $350 billion, is the bigger firms that had relationships with banks got the bulk of the money, and we really wanted to make sure these resources got down to the smaller businesses, as you said, the mom and pop businesses that really are devastated by this. What we did is we set aside $60 billion so they, for credit unions, community banks, and that's the places where a lot of these smaller businesses bank. We also wanted to make sure this money didn't go to private equity funds or hedge funds, and we also put those protections in.
What else will this new legislation do for Americans?
It continues to help shore up our healthcare system. There's $75 billion for hospitals, for providers, community health centers can apply for those funds. Another $25 billion to ramp up testing. We still don't have enough diagnostic tests. We want to make sure that's available before we even think about starting to unwind some of the stay-at-home orders. And then in addition, there's still a lot more work that we need to do to get a national testing strategy and a national recovery strategy up and running.
Democrats tried and failed to get Republican approval to send money to states who are facing extreme economic distress because of this coronavirus crisis. Do you think that that is something that will come in a future iteration of coronavirus relief coming out of Washington?
We're definitely going to fight for that. It's a priority for us on the Democratic side because we know how hard-hit states are, cities and local communities. So that's something that, I'm going to guess the Republican states were hit harder with this than Democratic states. So it's something that should be bipartisan. We should work together and we should get this done and try to make the local communities and the states, we can't make them whole, but we can certainly help them get through this.
And yet Senate Leader Mitch McConnell is saying that the states should file for bankruptcy. That doesn't sound like there's bipartisan action coming here.
Not from Mitch McConnell, but if you listen to Governor Cuomo, what he said is, New York and California, we're donor states. We send more money to the federal government than we get back. So Mitch McConnell's state gets more money from the federal government than Kentucky puts into the federal government. So it's Mitch McConnell who's getting bailed out right now by California, New York, and other places. Look, if you want to allow us to keep our revenue here in California, that's, we can negotiate that. But again, I think we ought to be helping the states and the local communities.
The death toll has now exceeded 50,000 people in the United States. And yesterday, President Trump suggested light and disinfectant as a way to fight the virus. In a recent interview, you gave the president a C- for his response to the pandemic. Would you still give him a passing grade?
I might have to revise that down to a D- or an F. I would tell him, one, leave the healthcare tips and the medical suggestions to the doctors. He has great doctors in Tony Fauci, Deborah Birx, and others. Let them give the medical advice. And anyone watching out there, household disinfectants, cleaning products are for surfaces. Don't ingest them. Don't put them on your body. Follow the directions on those products. And again, maybe I'm being generous with the D-.
President Trump does have these very strong advisors when it comes to the health response. And yet it seems he still speaks from a different place and a different voice, and he is not always in line with those advisors. What's going on there, and how do you, as a Congress member, put pressure on this administration to have a coherent, clear, and accurate message?
You know, the problem is I don't think President Trump listens to anyone other than himself. And, you know, he's prone throughout his presidency to follow conspiracy theories and, you know, some of these debunked theories. You know, it was fine for us to study hydroxychloroquine, but let's do it in a scientific way to see if it works. Obviously, the data right now doesn't look like it works. So I think it's dangerous when the President of the United States goes out there and touts these theories like, you know, ingesting cleaning products that are very dangerous and will kill people. So, you know, I wish we could control what the president says. Thus far, not even his own advisors can control what he says.
You know, let's turn now to testing. Scientists at Harvard have said that America needs to triple the number of tests that are out there for coronavirus before the country can consider reopening. Do you agree with that number?
Absolutely. We're still not testing enough folks, and we have to ramp up the diagnostic tests, those cotton swab or those swabs that allow you to tell whether the person has the diagnosis or doesn't. We also have to start ramping up serologic testing, those antibody tests that will help us make decisions as we start to open up to tell how many people in a community have certain level of immunity to COVID-19. And again, we recognize different states may start to unwind stay-at-home orders at different times, and you know, we've got to get up you know, to maybe 1.5 million tests a day, maybe even higher than that.
What has surprised you about our nation's response to this pandemic?
You know, I think the silver lining is the fact that we're all in this together. You know, I saw survey results that said 75% of Californians still recommend that we stay at home, and it's amazing how quickly we fell into compliance. And then you're seeing neighbors looking after neighbors, the human kindness that's coming out. And let's hold on to that. And let's come out of this looking after one another because we're all in this together.
Congressmember Ami Bera from Elk Grove, thank you so much for joining us.
Thank you. Be well, Priya.
As the coronavirus cuts deeper into the nation's economy this week, several southern states are beginning to reopen. This comes as protests were held across the nation over strict shelter-in-place regulations. In California, Governor Newsom says it's too soon to predict a date for the state to ease restrictions. But San Luis Obispo County says it's ready to begin cautious regional reopening now. And the county's state representative has formally asked the governor for his permission. Joining me now to discuss this is State Assemblymember Jordan Cunningham, the author of that letter. Assemblymember, tell me about why you think San Luis Obispo County is ready to start reopening.
Well, we took aggressive action as a county early on. We issued our own stay-at-home order a day before the statewide one. We've augmented our hospital capacity. We've acquired ventilators. We have an alternative care site at the university campus at Cal Poly stood up. In the gym, it's capable of ramping up to treat over 900 people. And while we were doing all that, we've been keeping a careful eye on our numbers of cases. Right now, in the entire county of 280,000 people, we only have one COVID-19 patient in the ICU in the hospital. So our numbers are looking good. We've done what we needed to do to flatten the curve, to get ready on the healthcare side. And I think it's time to transition to looking to reopening the economy in a phased in, scientific, intelligent manner.
So you've been preparing a roadmap for reopening in the county. Can you give us a first look at the changes residents would see if you start following that roadmap?
Well, the first thing is our county officials, in consultation with doctors and epidemiologists, and under the direction of our county public health director, they're all quite competent. They have recommended certain segments of the economy that have been closed down can start reopening. It's going to start with allowing medically necessary surgeries in our hospitals again. People have delayed getting back surgery. They've delayed maybe a treatment for a heart condition. They need to get back in the hospital, get treated. We're going to move from there possibly into allowing restaurants to reopen with proper physical distancing, PPE for the workers, proper spacing in the restaurant. And we're going to be doing that in phases, and we're going to be tracking as we go to make sure that we're not seeing a spike in cases and that we keep our hospital capacity and our healthcare capacity ahead of the curve. I think that's a way forward that would work for a lot of counties. I think our numbers justify doing it in that way. We're simply asking the governor some permission to start taking some of those steps now. And our geographic, relatively speaking, isolation, we're 200 miles from San Francisco, 200 miles from LA. What works in LA is not going to necessarily work here, but we're in a pretty good spot where we can start looking at reopening the economy. And it's important we do that. Not only are people hurting economically, they're out of work, they're scared, businesses are closing, worry they're going to close for good. It's important on the economic side, but also history shows us that prolonged recessions and high unemployment have disastrous public health consequences of their own.
Why don't you talk us through that, a little bit?
Yeah, we've been studying this as a society since the Great Depression. When people are out of work in large-scale numbers, depression goes up, stress goes up, heart attacks go up, suicide goes up. We're already seeing those indicators starting to go up here in our county and throughout the state. And if we're going to weigh public health in the balance and make good policy and find that balancing act, my contention is that we need to be looking at all types of public health issues. We've got a pretty good handle on the virus right now in our county. And I realize that not everywhere in the state's in the same place. That's why I think it makes a lot of sense, as Governor Cuomo has announced in New York, to look at doing this on a regional basis. And we're asking the governor of California, Governor Newsom, the permission to start doing that on a regional basis as well.
Will you move forward with his plan, whether or not you get a direct okay from the governor?
Our county officials are not going to do anything that directly conflicts with the governor's statewide executive order. I don't think that'd be responsible to do, but where that order allows for certain things, we're going to do those things that the governor's order allows us to do.
Tell me about the economic impact of the coronavirus on San Luis Obispo County, which is generally a very agricultural area, and you have a lot of tourism as well.
Well, our two biggest components of our local economy, as you mentioned, are agriculture and tourism, and they have been hammered. And unfortunately, no matter what we do, if we're keeping our eye on the ball as we need to do during a phased reopening of the statewide economy and our local economy, tourism is probably going to be among the last industries to come back. And that's going to hit us hard in San Luis Obispo County, which is why we need to get going as intelligently and quickly as we can on reopening some of our restaurants and maybe our wineries and allowing people to go to parks in small gatherings of 5 or less, things of that sort. I think on the agriculture sector side, if we can start phasing in some reopening of the restaurants, then those contracts they rely on for selling their lettuce to the restaurant, they'll start renewing those contracts, and we can get the wheels spinning there economically a little bit faster. Because I'm telling you what, my office is processing unemployment claims, helping people with that. We are seeing unprecedented calls, filings for unemployment. We're helping every small business we can try to get federal bridge financing just so they can stay alive right now. It's dire.
Assemblymember, do you approve of how Governor Newsom has been handling the coronavirus pandemic here in California?
I think he handled the first phase of it, the response to the public health crisis, ramping up our hospital capacity, issuing the statewide stay-at-home order. I think at that time was the right move. And I think he handled the first phase of responding to this virus pretty well. We're entering quickly into the second phase, which is handling the economic recovery and doing that in a way that doesn't make a slide backwards on the public health front. And me and a lot of local electeds and people from throughout the state are looking for leadership from them to let us sort of plan as a region and on a local level what we need to do to accomplish that.
Assemblymember Jordan Cunningham, thank you so much for being with us today.
Thank you.
This week, a team of researchers from UCSF began testing 2 very different communities to look for clues on how the coronavirus is spreading and who may have some degree of immunity from it. They first tested nearly the entire population of Bolinas, the small coastal town in western Marin County. Not only did they look to see who's actively infected, they also took blood samples to screen for antibodies to the coronavirus. Antibody testing helps scientists understand how widely an illness has spread through a community, even if some who've been infected don't show any symptoms. This weekend, they'll kick off the next phase of the study among residents in San Francisco's Mission District. Joining me now is Dr. Brian Greenhouse, an associate professor of medicine at UCSF and one of the principal investigators of the study. Dr. Greenhouse, thank you so much for being with us.
Thank you for having me on the show.
So let's talk about this study. It's the first of its kind in the nation, which is very exciting on its own. What is the basic question you're hoping to answer?
As many people know, we do not have enough testing going on in this community or in the world, really, to understand where we are in the epidemic, and we need to know where we are in the epidemic to know what to do moving forward. One of the things that we were trying to figure out was how do we go about testing a large number of people in a way that's safe, efficient, and can get information back to the people that need to know the answers as soon as possible. That was really one of the most important things about doing this study, is really just figuring out the logistics of how we can go out into a community, partner with that community, leverage the resources, volunteers, everyone's expertise, and the partnership between an academic institution like UCSF and the community of Bolinas to work together to test everyone.
Why these two communities?
There's two reasons for that. The first is that these communities are very different. They're just a few miles away. We're testing them within a week of each other, but they are miles apart in terms of how the communities are structured. Bolinas is a rural, small community. The Mission District is obviously a much more densely populated urban area. So they're quite different, and being able to compare them using the same methods at the same point in time in essentially the same geographic area will give us important information about where communities that might lie along that spectrum will be. The other reason that Bolinas was chosen is because the community actually chose to do this. They came to us at UCSF and said, hey, we are not happy with the limitations on our ability to get tested. We think that we can take charge of our own health and safety and do this, and will you work with us? And so that was an incredible opportunity for us to partner with the community to do that.
So how many were you able to test in Bolinas, and what's your expectation for the Mission District?
That's a great question. So we don't have the final numbers. That's what we're working on around the clock right now, is just trying to get all our data together. But on the order of 1,800 people were tested in Bolinas. For the Mission District, we're not testing the entire Mission District. It's going to be one census tract within the Mission District, and we're hoping to do somewhere between 5,000 and 6,000 people.
So let's talk a little bit about the antibody testing you're doing. You're not just checking who has COVID-19 right now, but potentially who's been exposed to it in the past. What can and can't antibodies tell us?
In the future, we hope antibodies can tell us a whole lot more than they can right now. But one thing that we're being very careful to communicate to the community and to the participants is that even if they do have a positive antibody, which is evidence of prior infection, we do not know yet at this time that means that they have any degree of protection against the virus. So they should, in particular, still take care of themselves to protect from infection and illness. What they can tell us is who might have been infected, and particularly we use this information not just to look at each individual, but on a community level, what proportion of the people might have been infected. This gives us really important information as to the degree of transmission that might have been occurring in the past, because when we test people for active infection, we're only capturing one single point in time. Antibodies essentially allow us to go back in time and see what we may have missed over the last few weeks or months.
In a recent tweet, you mentioned the shortage of testing kits and sharing a line from a colleague that, quote, we should look for anything with a stick and a fuzzy end. It sounds pretty dire. What's your perspective on the testing shortage?
Yeah, I mean, it's really surprising. One of the things that was surprising to the community members and to us as we started to look into what would be the barriers to doing this was that the testing capacity actually was there. The ability to actually run the PCR tests was created by a partnership with the UCSF clinical labs with some support from the Chan Zuckerberg BioHub. So they actually had the capacity. So basically, we went through all the different pieces that we would need to do the testing, and it came down to procuring swabs, the little Q-tip things that you stick in somebody's throat and nose to be able to test them. A number of people working together, we were able to find out how to get them, but it was really interesting having run a number of studies to have the barriers come down to something as seemingly simple as just getting swabs for a study.
From a public health perspective, what needs to happen before we can safely reopen?
That's a great question. We don't have all the answers, but I think the experiences that we've had and the lessons that we've learned and how you can safely and efficiently test an entire community will be one of the steps. We need to think about how we can expand testing and surveillance capacity to multiple communities and do it in a way that's dynamic and provides information in real time that we can respond to, so that we can start relaxing some of these broad interventions and do things in a more targeted way while still remaining safe.
The Mission District is going to be tested this coming weekend and for 3 days after that, yes? 4 days altogether. What are you hoping to see from that particular portion of the testing?
Same things that we're looking at in Beleaguered. We want to see who's infected so that they can protect themselves, their family, and their community. We're looking to see how much infection is going on in the community and who's being infected and who's getting sick. And then we're also learning to see how, we've just done this in a more rural area, and we've over a few days become a well-oiled machine and have a blueprint that we're hoping to share with towns and communities elsewhere. Now we're going to do the same thing in a more densely populated urban community. The lessons we learned from that will also hopefully be a nice blueprint for other cities and urban communities that are hoping to do similar things.
Dr. Greenhouse, you've worked extensively in the transmission of disease, malaria. What is interesting to you specifically about the coronavirus?
One of the really interesting things is how it's spread across the entire world. Many of the diseases I've worked on are only prevalent in one part of the world. Here we have a disease that is really affecting everybody, and because of that, the entire world is really chipping in to work together across disciplines, across institutions, and across countries. And it's been one of the most uplifting things for me working in this very stressful time to be able to communicate with other colleagues who are being so open with what they're doing and working so hard to bring all the experience and resources they have to bear to help fight this disease.
Dr. Brian Greenhouse from UCSF, thank you so much.
Thank you for having me.
Many parents who are now unexpectedly homeschooling their children are finding it to be a challenge. To help those parents and their kids, best-selling San Francisco-based illustrator Wendy McNaughton launched Draw Together with Wendy Mac, a free daily half-hour lesson on how to draw everything from bicycles to penguins. And now Wendy and her wife are raising funds to bring art supplies and lesson plans to thousands of children in underserved communities. Joining me now from their home in San Francisco are Wendy McNaughton and her collaborator and wife, Caroline Paul. Ladies, thank you so much for joining me.
Hi, so happy to be here. Yeah, we're psyched.
I have to let you know that in the name of research, we as a family went through one of your lessons yesterday. It was a lot of fun. We drew a rocket ship together and we had a great time. Everybody laughed, everybody enjoyed it. And I think one of the fun things about this is that while you have made it for kids, you say those kids are from ages 2 to 82, that you've got all ages who are participating in these new classes online. Can you tell me a little bit about the show that you've created?
Great rocket ships, by the way. Amazing. Draw Together with Wendy Mac. We created it we started the day that the school closures happened. And it's a 30-minute free daily drawing class for kids of all ages where families can gather together and draw. And it gives kids an opportunity to get creative, have fun, process some of the feelings that are going on, and also gives parents a 30-minute break to get some work done.
Now, you two don't have kids. What made you decide to create something that really was aimed at helping kids get through the day?
Well, we have kids in our life, and we also have a lot of friends who are parents. So we understood that when school closures happened, that was going to be really, really stressful. And we thought that maybe we could just alleviate some of that stress for the parents and add some fun. I mean, initially it was kind of light half hour, but it turned into something a bit bigger.
Yeah, we have gotten so many responses from parents almost immediately that it was providing structure for their days and that it was giving the kids something to kind of focus on and to help process, like I said, a lot of things that they're going through right now. Mm-hmm. I mean, so much is going on and the kids really might not understand all the details about it, but they take a lot of it in. And art is such a wonderful way for kids to get all that out on the page, get some energy out. And at the same time, have a great time. So we hear from parents a lot that it's been helpful on several levels.
And what's the show providing the two of you right now?
Well, we're stuck in the house with just a couple animals and each other, and we don't go out a lot. And so it's just been really fun to have, it provides a little structure for us, frankly, and a little stress release.
Yeah. And also both of our work is involved. We do a lot of research and I do a lot of drawing outside and stuff. So we're not able to go out and engage with the world in the way that we normally do, but we're able to do that indoors. And it's been great to connect with so many kids and families all over the world. There's like thousands of kids from over 40 countries who are watching every day. So I feel like we've kind of helped create this community of kids. They're not able to see their friends and hang out with them, in the way that they want to every day. But here we can gather together every day and draw together. They share their stuff online. People see each other's drawings, so a bit of community there.
Have you two collaborated together before, and how do you split up the duties for Draw Together?
Well, I am the camera person and the animal wrangler and food service, crafts. I mean, we are the only two people who we're the people that we can be within 6 feet of each other. So it's a kind of a rinky-dink operation over here. But
Caroline is the most incredible director of photography that the world has ever known. It's amazing. Everybody's becoming very resourceful this time. All this kind of like untapped, talent. Caroline does everything behind the camera, and I do everything in front. We've collaborated on 2 books before. So we have a really great working relationship. I mean, we're also married, so we have, we're good at working together.
Yeah.
And we've just evolved it into this new class.
You also have a GoFundMe page set up to help kids in underserved communities. Tell me about what you're hoping to do with that money that you raise and what you've been able to do already.
Well, the art classes themselves are free, but art supplies are not free. They can actually be pretty pricey. And right now, a lot of families are stretched just with housing and food. And considering that art supplies are kind of like this emergency relief service for kids, we think it's really important that all kids have access to making art right now. Whether they have access to the internet or not, they should have the supplies. So we started a GoFundMe to raise funds and partner with community-based organizations to get art supplies into the hands of the kids who need them. And we're working with local art supply stores to help business out there too. It's kind of an all-around win for everyone.
And what's the status of that GoFundMe right now?
We actually just fulfilled our goal,
Yeah.
the Bay Area goal. So it started here in the Bay Area. We're going to be able to provide 1,750 kits in partnership with Dropbox. We're sending them all out all over the city to our partners at community-based organizations. And then we're going to continue raising funds and reach beyond that to other parts of the Bay Area and to the East Coast. So onward.
Wendy McNaughton and Caroline Paul, thank you so much for joining me.
Thank you so much for having us.
You can follow Wendy on Instagram at her handle at Wendy Mac and catch her drawing class there each weekday at 10 a.m. Past classes are archived on YouTube and can be found through her channel, Wendy Mac. As always, you can find more of our coverage at kqed.org/kqed-newsroom. I'm Priya David Clemens. You can reach me through my social media handle, Priya D. Clemens. Thank you for joining us. Stay safe.